In this presentation, I'm going to chat about exercise for low back pain. What should you do? I have chosen to do this as a presentation because I think there's a lot of confusing information out there, and a lot of patients who suffer from low back pain may have experienced a worsening of their symptoms with exercise, and they may not be sure what they should do and what they can do. So in the next number of slides, I'm going to go through the different kinds of exercise that have a strong amount of evidence for being good for treating low back pain. So as we know, low back pain is a cause of significant symptoms for many patients. It can start from an inciting event, or it can gradually occur over time from small events that accumulate that are just a consequence of day-to-day living, day-to-day activity. If you do a lot of manual labor, for example, you might be more subject to accumulating this, and it's just really a part of life. When it comes to managing low back pain, there are a number of steps that should be taken. The first thing is you should have a clinical assessment, and during that time, your doctor or healthcare professional will assess you clinically and decide whether or not you need something like a scan. The pain will be assessed in terms of its severity, and it'll be decided whether or not you would benefit from short-term pain medication in order to help you be able to get through day-to-day activities. Whether or not bed rest is advised will also be discussed, and really for the vast majority of patients, bed rest is to be avoided. However, this is an individual decision and will warrant a discussion before deciding what you're going to do about that. The next step will be physical activity, and the rest of this presentation explains what types of physical activity you can do when you have low back pain. So it might seem counterintuitive to expect someone who's suffering from low back pain to engage in physical activity. And in the acute stages, and if the pain is severe, it might just be too difficult to do. There can also be a negative experience of exercise because people may have exercised with low back pain and experienced a worsening of it. However, finding an exercise program that you can do and that can help your symptoms is really worth the effort, as once you identify something that works for you, it means that you have a way of managing your symptoms going forward. So for example, if you engage in a stretching or a Pilates program or a resistance training program when you are in the more subacute stages of low back pain, and you find that it does really make a difference and it does help your symptoms, and then life gets in the way, things get busy, and you fall out of the habit of doing the routine exercise, then if the pain recurs, you know what works for you, and you know that if you go back to it, that there is a high chance that your pain will get better. So it's definitely worth spending time figuring out what you enjoy and what works for you. There are now enough studies that demonstrate that physical activity in low back pain does show benefits, and there really aren't any showing any adverse effects. So really the worst outcome that you should expect from physical activity in low back pain is just that the pain doesn't necessarily get any better. But you have to remember that you will still be gaining a lot of health benefits from exercise in general, so it really is a good thing to try to get into the habit of doing. Also, chronic low back pain is associated with greater deconditioning because the pain limits activity, and then because of that, you're doing less activity and your muscles can become weaker or just not as strong as they had been, simply based on the lack of physical activity and not necessarily based on having pain itself. In order for physical activity to help patients with low back pain, the exercise program, it really needs to take individual needs of the patient into account and preferences and capabilities. You're far more likely to do an exercise program that you both enjoy and that you feel you are capable of doing. Physical activity can be divided into just maintaining the activity that you're doing, aerobic exercise, resistance exercise, and things like Pilates, yoga, and stretching. The goal of a physical activity intervention for low back pain should have the following aims, or at least some of them. It should be designed, or at least hoped, that it will affect the pain intensity and the distribution. It is known, if it is done correctly in certain types of exercise that I'll explain later on, can improve spinal motion, alignment and posture, which will go a long way to improving back pain. It can enhance the stability of your spine. It will improve your cardiovascular fitness and improve your lower limb and back strength. When it comes to exercise and physical activity for low back pain, there are many options and it can be difficult to know which one is best for you. Options would include aerobic exercise, multimodal, where you do lots of different kinds of exercise within the one exercise program, Pilates, resistance, stabilisation and motor control exercise, stretching, water-based yoga. So it can be difficult to know what you should do. It can also be challenging as sometimes exercise can be perceived as making things worse. It should also be emphasised, because it cannot really be emphasised enough, that staying in bed for anything more than 2 days is best avoided if possible, as it does not significantly improve the pain, and really for most people it is just simply not practical. When there are no red flags, and you can see these detailed in the assessment presentation, the pain itself is not considered to be concerning. If you are able to perform light activity that doesn't significantly worsen your pain, there is a better outcome, and there's a strong link between early resumption of professional and leisure activities and a good short and long-term prognosis. When considering physical activity or exercise as a treatment, it is important also to consider what you want to get out of it. So I've mentioned so far a lot of the general benefits of exercise, both the resistance, aerobic, all the different kinds of exercise, but you also need to think about what you want to achieve from it. So the outcomes could be based on the pain, on your level of physical function, your mental health. Having the pain might get you down a lot, muscle strength, muscle endurance. And you need to consider what your outcome goal is. So are you trying to reduce pain? Are you trying to make yourself stronger or improve function? And it's likely that it will be something from all of these outcomes. It is unlikely that any one kind of exercise will be the single best approach to treating non-specific back pain, but it is good to get started with something. And I'll give a good evaluation of all the different kinds that you can do in the upcoming slides. I've said this in prior presentations and I'll say it again because it cannot be emphasized enough that remaining as active as possible and performing those activities that are tolerable is really important in the treatment of low back pain. So, not that it needs to be said again, but having low back pain, especially if it's chronic, has been shown to contribute to deconditioning. And this simply means that your aerobic capacity or fitness will be reduced based on the fact that the pain limits your ability to do physical activity. You may end up having weaker muscles in the low back. So this is something you may not be aware of because it doesn't really present with any particular weakness. But studies show that patients who suffer from chronic low back pain also have weakness of the muscles in and around the spinal column. And this over time just contributes to the ongoing chronicity of the pain. There can also be weaker muscles in the legs, and again, it's not like you'll present with weakness of your legs to your doctor. It's more that the muscles just aren't being exercised enough, and they will just be more subject to the age-related changes that happen in muscle. By not engaging in physical activity, there will be an increased risk over time of things like osteoporosis and the muscle breakdown that occurs with aging. There can also be poor coordination of the muscles in and around the lower back. Again, this won't cause you any particular symptoms, but it may be contributing more to the pain than you might realize. And a lot of the exercises that I'm going to describe in the upcoming slides, including things like Pilates and the motor function exercises, all target coordination of these muscles. So for the rest of the presentation, I will discuss the following exercise types because they have the most evidence for value in low back pain. There's Pilates, walking, aerobic or endurance exercise, resistance training that can be divided into general resistance training and lumbar stabilisation exercises, motor control exercises, and stretching. So firstly, we'll talk about Pilates. So what can happen when you have chronic low back pain is there can be maladaptive patterns of movement in the lower back. And this is because early on in the development of the pain, the muscles have adapted to cause the least amount of pain. But this is not necessarily the same as a normal movement pattern, and over time it's been shown to contribute to the pain. Also, stability and control of spinal muscles are altered in patients who have low back pain, and that includes alterations in how the muscles are activated or the sequence in which they are activated. Pilates is focused on the stability of the lower spine and the core muscles, which will facilitate the proper activation of these spine muscles. It combines both static, meaning you're not moving, and dynamic, meaning you are moving your muscles, stretching exercises that are safe and provide increased flexibility. The muscles surrounding the hips are also very important in the experience of back pain, and especially the hip muscles, because they provide a lot of stability when walking. And if these are weak, then the load will be increased on the lower back, and this can cause extra pressure and exacerbate the underlying problem. Pilates is based on a number of key principles. So first is centering, and this is really referring to activation of the core muscles in the back and the abdominal region. Concentration, so focusing attention on the proper performance of Pilates exercises. Control, where exercise is performed again with concentration and control of movement and posture. Precision means paying attention to the correct performance of the exercise. Initially, in order to achieve this, you should probably perform the exercises with just a few repetitions and then a gradual increase in the difficulty and a focus on the proper breathing rhythm. Breathing is a component of Pilates exercises, and the exercises are carried out in a breathing rhythm, as breathing promotes activation of the deep trunk muscles, and there's a flow, so it focuses on a smoothness in each exercise and a flow from one exercise to the next. So I think anybody listening to this who's done a Pilates class will relate to all of these. And this is why it's good, if you are going to choose to do Pilates, that maybe going to a physiotherapist who's trained in Pilates might be a good person to go to. And then as time goes on and you get more confident, you could either do it at home or follow online home exercise Pilates videos. Walking is actually really good for low back pain, and I think this is brilliant because walking is a fundamental human activity. It's easy to perform, there's a very low risk of injury, and it's associated with many health benefits. There are so many advantages. It's inexpensive, it's a daily activity for most people, it has a positive impact upon metabolic parameters such as the blood sugar levels, and it improves psychological status. And importantly, it has been shown that walking exercise in patients with chronic low back pain has reduced the levels of pain, disability, and also fear avoidance behaviour. I spoke in more detail about fear avoidance in the clinical assessment presentation and the presentation on low back pain, some facts. So walking will induce general aerobic activation. It induces back movement and rotation of the pelvis and movement of the legs in opposite directions. And this is one of the reasons that walking is so good for lower back pain. And as I've mentioned before, it's aerobic exercise, so you're gaining metabolic benefits. It is known that patients who have chronic low back pain will have an overall slower walking speed than those without it. And therefore, engaging in an exercise program for low back pain that is graded in terms of the amount of walking is a really good idea. So if you're walking quite slowly, you could start by continuing that, and with a focus on maybe either increasing the amount of time you spend walking or the speed at which you're walking. And both of these will, over time, improve, hopefully, the back pain. So like I said, this is based on studies, clinical studies in the literature showing that walking is really good for low back pain, and studies have looked at why this is the case. And they've looked at the pattern of activation of muscles in people who are walking. So they'll put on electrodes onto the lower muscles of the back so they can record activation of muscles, and then they get people to walk and they look at different speeds of walking and the different inclines of walking and seeing which muscles are activated, and then they also evaluate the patients to see if there's an improvement in their symptoms. So what they have demonstrated is that when you are walking, you are going to activate the muscles around the spine. So if you feel the bony prominences in the middle of your back, and then feel the muscles kind of running down either side, they're called the paraspinal muscles. And then you have multifidus muscles that connect the vertebral bodies to each other. Now, you can't feel those muscles on yourself, but these are the muscles that are specifically activated when you are walking. And these are also the muscles that are shown to be weaker in patients with low back pain and are thought to contribute to this ongoing low back pain, because the muscles aren't getting activated properly because they're weaker. It has been shown that walking at a slightly faster speed will be more likely to activate lower muscles in the back, and then walking at a slight incline has been shown to activate more of the middle muscles in the lower back. So aerobic or endurance exercise is really just good for everybody. It maintains good overall fitness levels. It should really be a part of everyone's routine. And as you'll see from the last slides, walking actually covers your aerobic fitness. And if you want it to be more intense, all you need to do is either increase the speed you're walking at or increase the incline that you're walking at. But just as a reminder, having good aerobic fitness and capacity will lead to a reduced risk of stroke and heart attack, a reduced risk of metabolic disorders such as diabetes, stronger immune system, better mood and overall energy levels, better sleep, and a reduced risk of cancer. And like I said on the prior slide, walking is aerobic. It has a very positive impact upon back pain. So it's really a great place to start. It's going to activate those lower muscles in your back, and it's also going to increase your heart rate, so you're getting a good bit of endurance as well. So resistance training, I've divided this into general resistance training and then the lumbar stabilization exercises. So the general resistance training really follows the principles of resistance training for everybody, which is that by exercising your muscles, you're going to build up good strength, you're going to increase the capacity of your muscles to withstand loads. And if you have greater strength in the muscles in your legs, it's going to naturally take some of the pressure off the lower back. So it's a really good idea to try to include some bit of resistance training into your general routine. On the YouTube channel that I have here, there are plenty of exercise videos that focus on resistance training on the lower body, upper body, and the whole body, and they are all designed for patients who want to get into resistance training but are not sure where to start. And I have done them with my physiotherapist, so at least you know that your technique is going to be really good, which is really important. You can start with body weight and then gradually add small weights as you get stronger. And it's just that these muscles can also become deconditioned if you end up not being able to do physical activity because you are experiencing a lot of low back pain. So lumbar stabilization exercises are also resistance training, but they're more focused on the muscles in or around the lower back, the spinal kind of stabilization muscles. They're very safe. They can be done with multiple stages, and you can start with the most basic level and move up the intensities and stages of the exercises. And this way it can be easily individualized to your own level of pain and your baseline level of mobility. So these are largely done either lying down or in kind of a tabletop position, and the idea is that you're not actually doing a huge amount of flexion or extension around the spine. You're more focusing on contraction of the abdominal muscles and then increasing the level of difficulty by making it a bit more challenging while still contracting those muscles. I'm just giving examples of the lumbar stabilisation exercise here. It's hard to explain them without showing, but in later videos I will go through them with my physiotherapist. So again, it can be lying on your back, and then you contract the muscles, and there's varying stages, but you eventually end up doing kind of a sit-up. There's one called a dead bug, side lying, lying prone, which is lying on your front, tabletop, and plank. So motor control exercises are exercises that are designed to look at the activities that you do day to day that typically might cause you pain, and seeing ways in which that activity can either be broken down into smaller parts or modified to reduce the pain. The principles of this kind of training are to try and move the lower back later in the movement and reduce the amount of lower back movements overall. And in doing so, you also increase the use of other joints such as the hips. So just to briefly explain what that means, it has been shown in patients who suffer from chronic low back pain that when they go to move, the lumbar muscles are the ones that move first and move the most, and they're not really as reliant on the hip and knee muscles. So it's trying to retrain that, because it can then take pressure off the lumbar muscles and allow them to be activated in the correct sequence. And this has been shown to improve pain levels in patients who have chronic low back pain. And again, it's based on this altered movement pattern that tends to happen in patients with low back pain, and it's not known if that's just contributes to them developing low back pain, or does it develop as they have low back pain, and this is what continues. The motor control exercises or motor skill training can involve targeting the abdominal muscles themselves or targeting the altered movement. And a typical example of this is picking up object. So day to day, most people would have to reach over and pick something maybe up off the ground or up off a lower table, and they kind of use that as a way to start the retraining of the muscles. Stretching is something we're all familiar with, and we're all familiar with the nice feeling of relief we get from a deep stretch. It is thought that one of the reasons for stretching improving low back pain is that it can overall increase the range of motion that will accompany the stretching. There is evidence for an increased blood flow by stretching of tiny blood vessels in the muscles. It can lead to an overall functional improvement as the muscle cells and the joint receptors just respond well to being stretched. You can do general stretching as you might do in yoga poses, and there are plenty of yoga stretches that focus specifically on stretches that are good for the low back. And there's also a stretching program that's called Global Postural Re-Education, and this specifically looks at the lower back in different positions. And it does the stretches for perhaps a longer amount of time than a typical stretch, but then less pressure on the particular muscles. And rather than try to explain this without showing it, I'm going to leave that explanation for the next set of exercise videos that I hope to do with Sophie, my physiotherapist, and I think they'll be really useful when they're available. So just to conclude, it can be really confusing if you suffer from low back pain to know what you can and can't do. For the most part, exercise is safe, and if there is an increase in pain, you can use a traffic light system, which I explained in the low back pain some facts presentation, and that can guide you in what to do. There are many types of physical activity you can do, and in this presentation I've tried to give an overview of the different types and the ones that have the greatest evidence in the literature. If you're not currently doing any exercise and you do have low back pain, a really good place to start would be walking. And then once you gain confidence with this, and even better if your back pain is improving, you could then consider introducing some of the other types of exercise I've described. I've lots of videos of gentle resistance training, and there will be more to come. So this will be a really good resource if you are suffering from low back pain. So I hope this is of help. Thanks.